Thank you very much, Dr. Walensky. I'd like to address three separate points very briefly, and then we could leave that open for questions and discussions. As you know, last week, with the data that came out from the J&J Janssen vaccine trial, as well as information from the Novavax trial, I think it's important for people to appreciate that we now have the three separate vaccine platforms: mRNA, soluble recombinant protein, and viral vectors in the mix right now. Obviously, the J&J will be putting their information into the FDA for an application for an emergency use authorization. The reason I bring this up is that as these things roll out, they will have different degrees of what's called point vaccine efficacy. So we know that we had a 72% overall efficacy in the United States for the J&J. But important to point out when people ask about the difference between 72 and 94, 95 with the Moderna and the Pfizer is the fact that when you look at serious disease, hospitalizations and deaths, it has had a profound effect on that. So as we get into the next weeks and months and more vaccines come out, there may be different, there'll be common use of them in the big pool of vaccines, not only for the United States, but worldwide. But there may be some advantages that you might see with one versus the other. For example, the idea of a single dose, the lack of a very strict cold chain, as well as the availability of having a large number of doses. So I just bring that to your attention. Now, Dr. Walensky mentioned the issue of variants, and there's a real relationship now between the vaccines that have already been given an EUA, those that will get an EUA, and how we address the variants. When the variants were first recognized in South Africa and in the UK and in Brazil, one of the important things that one does is take serum from individuals who have been vaccinated with the available vaccines and see how well they do against the variants. What became clear is that with regard to the variant, namely the 117, that was a variant that was predominant in the UK, there was very little impact on that. And actually, that was shown by the Novavax study, which was done in the UK when they had a 90% efficacy, and the dominant variant there was the 117. So you would expect that it reflected what you would see. But we do know that antigenic variation does have clinical consequences, because when you looked at the South African isolates, namely the 351, that one had a multifold diminution in the efficacy of antibodies induced by various vaccines that are in use now. But it was still within the cushion level of providing some protection. The reason that was important is that that was reflected in the J&J trial. So we're learning not only that we have more vaccines, but we're learning about the virus and how it interacts with our ability to protect with vaccines. Because when you look at advanced disease, hospitalizations and deaths, there was a profoundly positive effect by the vaccine, even though the effect numerically was diminished. So for example, there was about virtually no hospitalizations or deaths in there. Now, getting to the third point, which I believe is important and relates to what Dr. Walensky said, that it is important, even when you have a variant circulating in which you may not have a 95% efficacy to prevent infection, it is very important that you might very, very positively prevent serious illness and serious disease. We've been asked questions often. Well, if you have these variants and they seem to be eluding the vaccine a little, should we really be getting vaccines, or should we wait for the next generation of vaccines? The answer is you need to get vaccinated when it becomes available as quickly and as expeditiously as possible throughout the country. And the reason for that is that there is a fact that permeates virology, and that is that viruses cannot mutate if they don't replicate. And if you stop their replication by vaccinating widely and not giving the virus an open playing field to continue to respond to the pressures that you put on it, you will not get mutations. So when we're looking at what we have here in the United States, as well as globally, when we talk about efficiently and getting these vaccines out there and into people as quickly as we possibly can, not only are you going to protect individuals from getting disease, not only are you going to protect them from getting infected, but you are going to prevent the emergence of variants here in our country. And when you look at the global situation, which is the reason why we want to make sure we're part of a global community, and we recently have joined the COVAX, which is a consortium to get people vaccinated throughout the world, is that the only way we're going to completely stop mutants is if we stop this throughout the world. So again, Dr. Walensky gave you the 4 or 5 things you need to do to protect yourselves. I want to emphasize the last thing she said, which is very important. When the vaccine becomes available to you, please get vaccinated. So I'll stop there and hand it over to Dr. Nunez-Smith.